Hello and welcome back to the podcast. My name is Tasha Gandamihaja and I am your host. In today's podcast, I'm going to talk about cancer recurrence. This is a topic that is not only important to talk about, but is also one that for anybody who has had breast cancer treatment is something that may be a thought that is omnipresent. And so I'm going to talk about what you can do so that any recurrences may be detected early. I'm also going to be talking about the signs and symptoms you need to look out for that may be an indication that something isn't quite right. First things first, let's talk about where does cancer come back or recur. Well, you can categorize recurrences into three areas: local recurrence, regional recurrence, and lastly, distant recurrence, which is also known as metastatic disease or stage 4 cancer. Local recurrence means that the cancer has come back locally, so in the breast or on the chest wall. Regional recurrence means that the cancer has spread to the lymph nodes or glands in the armpit or nodes at the base of the neck. And distant recurrence means that the cancer has spread to other parts of the body, which can either be the lung, liver, bones, or the brain. So the first way we can detect local recurrence is simply by doing a self-examination. And for anybody who has had breast cancer treatment, it remains important to continually be examining yourself and being aware. This is certainly true whether you've had a lumpectomy, whether you've had a mastectomy and have gone flat, or you've had a mastectomy with a reconstruction. Examine yourself with the flat of your hand and fingers and do this once a month. So, what are you looking for when you are doing a self-examination? For local recurrence, you need to be examining your breasts, whether that is your own breast or reconstructed breast. And if you've had a mastectomy and you have gone flat, then you should also be examining your chest wall. Doing an examination along the scars is also very important. You are looking for lumps or nodules, thickening of the skin, or any change in texture. Dimpling is also something you should be looking out for, as well as noticing spontaneous nipple discharge. If you notice any of these changes, then do get them checked out. Now, it doesn't mean that they are definitive recurrences, but if they are new, it's best to get a doctor to check them out for you. For regional recurrence, you should remember to examine your armpits as well as the areas just above your clavicles or your collarbones. What you're looking out for or you are feeling for are enlarged lymph nodes or lymph glands, and they will feel like prominent nodes and are quite obvious to feel. The second way we detect recurrences is by performing scans. Now, if you've had breast cancer treatment, these are normally mammograms that you will have once a year for at least 5 years following your cancer diagnosis. Or when you reach the age of 50, that's when you will be getting your annual mammograms until. And the reason why we would still do mammograms regularly is because not all recurrences will be palpable or will they present as lumps. Some recurrences can only be seen on mammograms, especially DCIS. If a lump is palpable, then an ultrasound scan will also be done, as this is a really good tool to look at specific areas. So how about distant recurrences? Well, as mentioned earlier, the areas that breast cancer can spread to include the liver, lungs, bones, as well as the brain. Now, occasionally it may spread to the lining of the stomach or appear on the surface of the skin as nodules. And the symptoms really does depend on where the cancer has gone to. Joe Taylor from ABC Diagnosis has produced some really useful infographics describing the signs and symptoms of secondary breast cancer. And I will leave the links in the show notes, so do check them out. Only a small percentage of patients actually present with metastatic disease at the time of their diagnosis. Approximately 6 to 10% of new breast cancer cases are stage 4 or metastatic. The majority of patients present with symptoms of metastatic disease after the initial diagnosis and treatment of a primary cancer. Unfortunately, statistics are not collected for recurrences or when someone develops metastatic disease following a primary diagnosis. Despite this, the number is estimated to range between 20 to 30% of existing all breast cancers. So, what are the 5 things to look out for, which are also known as the red flag symptoms? Well, number 1, if the bones are affected, then bone pain can either be a dull ache or sharp pain that isn't going away and there's no history of trauma. Number 2, if the liver is affected, then the symptoms could include a sensation of bloating, abdominal pain or discomfort, especially in the upper outer aspect of your abdomen. You may also feel tired and have no appetite. Number 3, lung symptoms. They may be a non-productive cough, sharp pain when breathing or shortness of breath. Number 4, brain symptoms may include dizziness, nausea, mood swings, unsteadiness on your feet, fatigue, vomiting and visual disturbances. And lastly, spinal cord compression, which is a rare red flag symptom, but one that needs urgent attention. And the symptoms may include severe lower back pain that doesn't go away, numbness or electrical shock sensation, pins and needles down your limbs. You may experience weakness, numbness in the area around the back passage, and inability to empty your bowel or bladder and problems controlling the bowel or bladder. Now, if you get any of the symptoms, you should get urgent medical attention. Again, it may be nothing, but it's best to get them checked out. If there were any abnormal symptoms, then you may get scans to check the specific areas of the body out, and they may include a CT, a bone scan, or a PET scan. And if we were to see anything abnormal on the scans, then we would need to get a tissue biopsy to find out what it is that we are dealing with. So I hope this has been helpful. Do connect with me on social media. You can find me at Dr. Tasha G, that's Dr. Tasha G on Instagram, and let me know what you think about the episode. If you want to connect with me, that would be fantastic. Thank you once again, and I'll catch you in the next episode. Take care.